Welcome to our video. Today we're going to be talking about the phenomenon known as somnambulism. What is somnambulism? Well, somnus is Latin for sleep, and ambulo for walk. So somnambulism is commonly known as sleepwalking. Sleepwalking is a sleep disorder that involves carrying out complex behaviours while asleep. Although usually associated with walking, symptoms can range from just sitting up in bed and looking around to getting up and walking out of the door. According to SciComm, 4% of Americans have experienced sleepwalking in the past year, and 30% of adults say that they've had an episode at least once in their lives. Nevertheless, sleepwalking is most frequent in children, affecting between 2 and 14%. It usually affects boys more often than girls. It is most common in children between the ages of 6 and 12 and comes to an end before puberty.
The symptoms and criteria for diagnosing sleepwalking. The ICSD-3 criteria includes recurrent episodes of incomplete awakenings, absent or inappropriate responsiveness, limited or no cognition or dream report, partial or complete amnesia for the episode. Arousals are associated with ambulation and other complex behaviours out of the bed. The disturbance is not better explained more clearly by another sleep disorder, mental disorder, medical condition, medication or substance abuse. Comorbidity. Forby claims that sleepwalking and sleep terrors often coexist together, and it is common for one to blend into the other, making it difficult to distinguish from one another. In addition, Gao and Song compared 21 people who suffered with either sleepwalking or sleep terrors to 30 controls, measuring sleep habit, sleep disorders, and personality characteristics. Overall, they found that the case studies were more likely to suffer with anxiety disorders, with results showing that 76.2% of the case studies reported having an anxiety disorder, compared to just 16.7% of the controls.
The mechanisms behind sleepwalking. Sleepwalking is most likely to occur during the deepest stages of sleep, stages 3 and 4. This is when the brainwaves are the slowest. It will not occur during REM sleep, as your brain is very active. This is when you dream and your muscles become paralysed, stopping you from acting out your dreams. You can't cause brain damage or a heart attack by waking up a sleepwalker, but they can be very confused or lash out due to fight or flight response. Scientists are still unsure why sleepwalking occurs, but they do have a few ideas. One suggestion is genetics, as research has shown that sleepwalking is 10 times more likely to occur if a first-degree relative has sleepwalked. Second suggestion is an underdeveloped brain. The inhibitory neurotransmitter gamma-aminobutyric acid suppresses the brain's mode system. However, the neurons that release this neurotransmitter aren't fully developed in children, and therefore the brain may still be active. A child grows out of sleepwalking as they develop. If sleepwalking continues into adulthood, there may be factors such as sleep deprivation, increased stress, fever, sleep interruptions or travel, or underlying medical conditions such as alcoholism or clinical depression, which may be causing the sleepwalking to occur.
Treatment may be necessary if sleepwalking is causing the individual high levels of distress or puts them in danger, despite having appropriate safety measures in place. Sleepwalking in children can be improved by having a regular sleeping pattern and ensuring an adequate amount of sleep each night. A technique called anticipatory awakening can also be used. This is where parents awaken their child just before they usually sleepwalk. It is simple to do, of low risk to the child, and does not cost anything. Treatment for adults most commonly uses the following medication: benzodiazepines, particularly clonazepam, with tricyclic antidepressants and selective serotonin reuptake inhibitors. Therapy can also be offered. There are common underlying causes such as sleep apnea, upper airway resistance syndrome, restless leg syndrome, and periodic limb movements. Treating these underlying causes has been found to be one of the best ways to improve sleepwalking and can stop sleepwalking in both children and adults.